It stopped.
Okay.
All right. Hi, welcome to our office. My name is Laura and I'm a pediatric nurse practitioner. How may I address you today?
You can call me Caitlin.
Okay, hi Caitlin.
Hi, nice to meet you.
Are you by chance familiar with the pediatric nurse practitioner role?
Not really.
Okay, so basically we're advanced practice nurses. We went to school for an additional couple years and we are able to diagnose, prescribe medications, and see patients, and for me it's specialized in pediatrics, and basically be your primary care provider.
Okay.
So now I know this appointment today is for your 3-year-old son, Dominic, and what brings you in today?
Just for his yearly well check.
Okay. I'm going to be taking some notes
Okay.
During this visit as well.
Sure.
So when was Dominic's last health care appointment?
It's probably his last October well check.
Okay. So just his yearly.
Mm-hmm.
All right. All right. And does Dominic have any significant illnesses, any chronic problems?
No.
Okay. Has he had measles,
No.
mumps,
No.
whooping cough,
No.
chicken pox?
No.
Okay. Smallpox,
No.
scarlet fever,
No.
rheumatic fever,
No.
diphtheria,
No.
or poliomyelitis?
No.
All right. Okay. So now we're going to talk a little bit about Dominic's past medical history. So do you have any current concerns about Dominic's health or well-being?
No. Not at the moment.
Okay. So how is he doing these days?
He's good. He's, up to date with all his immunizations.
Great.
And he's a happy kid. He's overall really healthy.
Great, great. So you said that you have a documentation of all of his immunizations that you're going to give to me after the visit, correct?
Yes.
Okay, so we'll go over those. So when was his last flu vaccine? Has he had one ever?
No, we have never given him the flu vaccine.
Okay. And has he had a TB test?
Yes, he
Okay.
has.
And do you know when that was?
That was about a year ago.
Okay. And do you know the results? Were they negative?
Negative.
Okay. Okay. Now, has Dominic been around anyone with any contagious diseases?
Yes, he actually was around a case of hand, foot, and mouth.
Okay. And how long ago was that?
That was about 3 weeks ago.
And who had this illness?
Another toddler in his little play group.
Okay. And has he come down with any issues since then?
No.
Okay.
He's been fine.
Has he been exposed to chicken pox or TB, hepatitis B recently?
No.
Okay. Great. Does Dominic have any allergies to any medications?
No.
Penicillin?
No.
Latex?
No.
Plants?
No.
Does he have any seasonal allergies?
No.
Okay. Has Dominic ever had any major hospitalizations?
No.
Okay. Any surgeries?
No.
Okay. Any ER visits?
No.
All right. Great.
Yeah.
Has he had any injuries, accidents, or accidentally ingested some harmful substances?
There was a time where he sprayed some aerosol sunscreen in his eyes.
Okay.
So he was a little sore for a couple hours and red and irritated.
Okay. And it just resolved on its own? Did you have any interventions for that?
We just at home we kept flushing his eyes with water, and then it did resolved.
Okay, great. Does Dominic take any medications on a regular basis?
No.
Okay. Any vitamins?
He does take a daily vitamin.
Okay, great. Any herbal?
No.
Okay. Does he use any alternative therapies by chance, such as acupuncture?
No.
Okay. Any prayer?
Well, we pray for our kids
Okay.
regularly.
All right. Now we're going to talk a little bit about your pregnancy. We're obviously referring to Dominic.
Okay.
So was this a planned pregnancy?
Yes, it was.
Okay. And at what point in the pregnancy did you start seeking prenatal care?
I was 6 weeks
Okay.
along.
Did you have any of the following during pregnancy? Any infections?
No.
Okay. Did you have any case of rubella?
No.
Okay. How much weight did you gain during Dominic's pregnancy?
About 40 pounds.
Okay. Did you have any bleeding, convulsions, diabetes,
No.
hypertension?
No.
Did you drink any alcohol during that pregnancy?
No.
Okay. And where was Dominic born hospital-wise?
He was born at Central DuPage Hospital in Winfield.
Okay. Did he go to term?
Yes.
Okay. And how long and difficult was the labor with Dominic?
It was fairly easy. It was about 4 hours long.
All right. Vaginal or C-section?
Vaginal.
Okay. Did you have any complications during the delivery, such as
No.
forceps or vacuum?
No.
Okay. We're lucky. Do you know by chance what Dominic's birth weight was?
He was 7 pounds, 14 ounces.
Great. Did Dominic have any problems after a delivery, such as cyanosis, jaundice, convulsions, congenital abnormalities, difficulty feeding?
No.
Okay. And did he stay in the nursery? Do you know how long?
The standard time, I think it's 2 or 3 days.
Okay. So was he discharged with you?
Yes.
Okay. Okay. Now we're going to talk a little bit about your family history. So now, are you married?
Yes.
Okay. So, and what's your husband's name?
Frank.
Okay. Are Frank's parents living?
Yes, they are.
Okay. Both mom and dad?
Mhm.
Okay. Now, are your parents currently living?
Yes.
Okay. Any divorces, separation, additional parents, or are both sets of parents
Yes.
still together?
Mhm.
Okay. And I think I remember from a prior visit, but you have Dominic and then other children as well?
Yes, 2 other children.
Okay.
Anthony and Nico.
And how old are they?
Anthony is 7 and Nico is 2.
Okay. And then we have Dominic, who's 3. And how old are you, Caitlin?
28.
All right. And how old is Frank?
28 also.
Okay. And do you know your parents' ages?
Yes. Exact ages?
Around,
Okay.
you know.
Yeah, Frank's parents are 55 and 53.
Okay.
Mm-hmm.
And your
then
parents?
54 and 56.
Great. Now, do you, basically I'm going to go through a list of some health conditions, and if you hear something that you know you have somewhere in the family, if you could just let me know who has it. And also real quick, does Frank have siblings?
Yes, he does.
Okay. Who does he? Who are his siblings?
He has an older brother,
Okay.
John. What their names?
Yes, please.
Yeah, John is 30.
Okay.
And 2 younger sisters, Rebecca
Okay.
is 18 and Sarah is 19.
Okay. And what about you? Do you have any siblings?
I do have an older brother,
Okay. And how old is he?
30.
Okay. Great. So now, like I said, we're going to go through a list of health conditions, and basically if someone in the family, either on your side or Frank's side, has it, let me know. And basically, you know, we're kind of focusing on Dominic's health history, so any conditions that run in the family might be significant to Dominic's health. So anybody in the family with allergies?
Yes, quite a few of them
Okay.
have seasonal allergies. My parents,
Okay.
and then Dominic does not, but my 2 other children do.
Okay. So Anthony and Nico.
Yes.
All right. And do you have allergies?
I do have seasonal allergies.
Okay. And your brother?
Yes.
Okay. Great. Any asthma in the family?
No.
Okay. Any high blood pressure?
Yes.
Okay. And who has?
My husband
Okay.
and his father.
Okay. And any heart disease?
No.
Okay. Any stroke?
No.
Diabetes?
No.
Cancer?
No.
Thyroid disease?
Thyroid, yes.
Okay.
My husband's mother.
Okay. Blood disorders?
No.
Obesity?
No.
Vision or hearing problems?
No.
Okay. Genetic or congenital diseases?
Yes.
Okay.
My husband's sister
Okay.
has Down syndrome.
Okay. And any neurologic problems such as seizures, emotional disorders?
No.
Okay. And any drug or alcohol abuse or problems?
No.
Okay, great. All right. Do you have any other concerns about any family illnesses or questions for me?
No.
Okay. So who lives at home with Dominic?
Myself, my husband Frank,
Okay.
and then Dominic and his 2 brothers, Anthony and Nico.
Okay. And what do you and Frank do for a living?
I'm a hairstylist, and then my husband operates a website from home.
Okay. Do you guys currently have health insurance?
Yes.
Okay. Is it through your work?
Yes.
Okay. Do you feel that it's adequate coverage?
Yes.
Okay. For both primary care and if someone needed some inpatient services?
Mm-hmm.
Okay. Is Dominic in any preschool or program such?
He's in a nursery during a Bible class.
Okay. How many times a week is that?
Once a week.
Okay. Now regarding Dominic's habits, does he have any bedwetting issues?
No?
Okay. Good. Thumb sucking?
Mm-mm. No.
Nail biting?
Nope.
Temper tantrums?
No.
Now what forms of discipline do you use with Dominic?
We put him in timeout.
Okay. Does that seem to be effective with him?
Yes.
Okay. Now how many hours a night does Dominic sleep?
At night, about 11 hours.
Okay. Does he take any naps?
He takes an afternoon nap for a good 2 to 3 hours.
Any nightmares?
No.
Okay. So is Dominic active? Does he play?
Yes, he's very active. He loves to play outside or any sports with his brothers.
Great. Now does he, how much time each day does he spend in front of a TV or a computer?
Maybe 1 to 2 hours.
Okay. All right. Now we're going to talk a little bit about Dominic's diet. What does he typically eat in a day? Maybe a few examples of breakfast, lunch, and dinner.
Okay. For breakfast, usually cereal,
Okay.
maybe some fruit.
Great. What about lunch?
Lunch, usually a sandwich with maybe chips or applesauce.
What's a typical dinner for Dominic?
Usually a meat, kind of protein with a vegetable and maybe a rice or some side dish.
Okay. Does Dominic have snacks?
Mm-hmm.
Okay.
Yeah, he has snacks, maybe granola bars, fruit snacks.
Okay. Does he drink juice?
Yes, he does.
How much about per day?
Usually, maybe total like 8 ounces.
Okay.
We dilute it with water.
Okay. What about milk?
Same, maybe about 8 ounces.
Any soda?
No.
Okay, good. Have you or anyone in your family witnessed any violence
No.
or abuse surrounding Dominic?
No.
Okay. Now regarding Dominic's development, what is his typical talking? Does he talk in sentences? Does he use single words?
Yeah, he talks in sentences.
Okay. How many words would you say he uses in his sentences?
7.
Oh wow, okay, great. Is he able to hold a crayon or pencil?
Yes.
Does he use scissors?
Mm-hmm.
Okay. Does he dress?
Child scissors.
Oh. Does he dress himself?
Yes.
Okay. Now, does Dominic have a child safety seat when traveling in a motor vehicle?
Yes.
Does he wear protective gear if he's playing any sports or riding a bike?
Yes.
Okay. Do you know in your home, do you have a functioning smoke detector and
We
carbon
do.
monoxide?
Yes.
Okay, both. Okay. Has Dominic ever been exposed to any violence, pollution, secondhand smoke, or lead?
No.
Okay. What about radon?
No.
Okay. Has Dominic ever had a lead level drawn?
No.
Okay.
There is no reason for it.
Okay. And do you have any religious affiliations that would affect Dominic's health? Maybe practices that are against your religion or anything
No.
like that? Okay. Okay, so now we're going to kind of go through Dominic's system and just his systems and just see if there's any, if he has a history of any of these problems. So, has Dominic had a history of fever, chills, fatigue, or night sweats?
No.
Okay. Has he had a change in weight recently?
No.
Is Dominic complaining of any pain today?
No.
Does he have a history of any skin conditions, eczema?
You know what? He has had an eczema case, when the weather changed.
Okay.
But we just used like a cream, a topical cream, and it cleared up within a couple days.
Okay. What kind of topical cream was that?
Like a cortisone, I believe.
Okay. And now you said it, how many days did it last?
About 2 to 3 days.
Okay. And when did that start? I know you said with the change of seasons. Now from...
Yeah, so just, it was pretty recently, actually, in September, late September.
Okay. And now where on his body was the eczema?
On his knees.
Okay. And did he have any pain with...
No, he itched a little bit.
Okay. Itch. Okay. Any other itching or rashes not regarding the eczema?
No.
Okay. All right. Does he have any new moles or changes with any current moles?
No.
Does Dominic use sunscreen?
Yes, when he's in the sun, he puts
Okay.
sunscreen on.
What SPF do you usually use?
30.
Okay. Do you have any issues with any of his nails?
He has a black and blue nail on his toe
Okay.
from an injury.
What kind of injury?
He dropped a toy on his
Okay.
toe.
And how long ago was that?
Maybe 3 weeks ago.
Was there any pain with?
For a little bit.
Okay.
He was sore.
But not anymore?
No.
Okay. All right. Are there any changes in the distribution of hair on his scalp or the texture of his hair recently?
No changes recently, but he was born with, he has a little bald spot on the side of his head.
Okay. Any changes with that bald spot?
No.
Okay. Do you have any issues with Dominic's eyes?
No.
Okay. Has he had an eye exam?
No, he hasn't had an
Okay.
exam yet.
So I'm assuming, does he wear glasses?
No.
Okay. Has he had any eye infections?
No.
Any drainage?
No.
Have you ever noticed a wandering or lazy eye?
No.
Does Dominic have any problems with hearing?
No.
Any dizziness,
No.
ringing in his ears?
No.
Has he ever had an ear infection?
He has.
Okay. When was that?
He was about 9 months old.
Okay. And how long did it last?
Maybe a week.
Okay. Do you remember which ear it was?
His right ear.
Okay. And how did the infection resolve?
We were on antibiotic.
Okay.
Amoxicillin.
Okay, great. And that seemed to cure it? Okay.
Yes.
And has he had any recurrent?
No.
Okay, infection since then, okay. Great. Does Dominic have frequent colds?
No.
Okay. Any sinus pain or infections?
No.
Okay. Nosebleeds?
No.
Snoring?
No.
Okay. Mouth breathing?
Mm.
Okay. When did Dominic first develop teeth?
He was 8 months old.
Okay. Has he lost any of those baby teeth yet?
No.
Does he have any dental problems?
No.
When did he last see a dentist?
About 3 months ago, he saw a dentist.
Okay. What are his brushing and flossing habits?
Well, I or my husband help him brush and
Okay.
floss
Okay.
daily.
Great.
In the morning and then before bed.
So 2 times a day?
Yes.
Okay. Does he go to sleep with a bottle?
No.
Okay. Does he ever complain or do you notice any stiffness of his neck or pain?
No.
Okay. Any lumps or tenderness that you've noticed?
No.
Okay. Does he have a history of asthma?
No.
Okay. Any shortness of breath or
No.
wheezing?
No.
Any cough, sputum production?
No.
Any chest pain?
No.
Hypertension?
No.
Were you ever told that he had a heart murmur?
No.
Any congenital heart disease?
Mm-mm.
Fatigue?
No.
Tiring with feeding?
No.
Okay. So what, does Dominic have any problems with stooling? Does he ever have diarrhea or constipation?
No, he's pretty regular.
Okay. Any nausea or vomiting?
No.
Okay. Abdominal pain?
No.
Food intolerance?
No.
Okay. Rectal bleeding?
No.
Okay. Is Dominic toilet trained?
Yes.
Okay. Does he have any problems with urination?
No.
Okay. Have you noticed any blood in his urine?
No.
Any urinary tract infections? No. Did you have Dominic circumcised?
Yes.
Okay. Do you notice any swelling with crying or stooling?
Mm-mm. No.
Okay. And you said history of bedwetting?
No.
Okay. I know we talked about that earlier. Okay. Now, as far as his muscles, do you notice any limitations in his range of motion?
No.
Okay. Any swelling or weakness in the joints?
No.
Any problems when walking?
No.
Okay. No balance issues?
No.
Okay. Does he have a history of any head injuries or loss of consciousness?
No.
Any dizziness,
No.
seizures,
No.
tingling,
No.
tremors,
No.
any headaches?
No.
Okay. Loss of coordination,
No.
numbness?
No.
Does he have any problems with memory?
No.
Okay. Have a history of any anemia or bleeding tendencies?
No.
Does he have a history of blood transfusions?
No.
Thyroid problems?
No.
Unusual sensitivity to hot or cold environments?
No.
Any history of eating or drinking, eating an unusual amount or being unusually thirsty?
No.
Okay. Any mood changes?
No.
Behavior problems?
No.
Okay. Well, that pretty much covers our health history for Dominic. Do you have any other concerns or regarding something that we did not touch on?
No.
Okay, great. Well, thank you so much, Caitlin.
Thank you.
And next we'll be moving on to the physical examination.
Okay.